Thank you everyone for joining us this afternoon and dealing with our technical snafus. I am Dr. Nicole Rankins. I'm a board certified OBGYN. And I also host a podcast called All About Pregnancy and Birth. And I am a medical advisor for Tiny Health. And if you don't know, Tiny Health is, of course, I've taken over their account for the day, is a gut and microbiome testing platform for moms, babies, actually the entire family. I got interested in this because the microbiome has actually also always fascinated me, that we have something like 10 times as many bacteria and organisms that live on and inside and with us, and how that impacts our health. And that's exactly what Tiny Health looks at, like how the gut microbiome, the vaginal microbiome impact the health of moms, babies, and families. And also, one of the things that's really important to them is reaching out to communities that are traditionally underrepresented in research and underrepresented in just healthcare in general. So that's one of the reasons that we're working together, or that I like working with them as well. And we also have today Erica Freeman from Sisters in Loss, who I feel like I already know because I have admired and follow her work for quite some time. So I'm really grateful to have her here to have this discussion today during Black Maternal Health Week about Black maternal health. And Erica, if you want to go ahead and start and introduce yourself, tell us about your organization and your work, that would be great.
Yes. I know I always feel like fellow podcasters and kindred sisters, especially when we get the time to share space, even virtually. So thank you all at Tiny Health for allowing me to be in this space to talk a little bit about what Sisters in Loss does. So Sisters in Loss is a maternal child health company where we focus mainly on Black women who've experienced pregnancy and infant loss and infertility. My work, I guess I have come into this work as a patient advocate, but really my birth story inspired the work that I do in storytelling and being a advocate and activist and making sure that we're changing policies, not only statewide, but obviously in the federal wide. And it's the reason why Black Maternal Health Week is so important, especially as someone who's gone through loss, stillbirth, second trimester loss, and then as a maternal.
Before we even can you tell us a little bit about what happened with your own pregnancy?
Oh, yeah, absolutely. So I experienced two losses. I had a stillbirth at 32 weeks. At 39 weeks. My son was born through complications with preeclampsia and just wasn't born breathing. And the doctors ended up doing a C-section with him after many hours of labor. And, he came out and he just wasn't breathing, and they tried everything they could do to revive him, and ended up having we ended up getting an autopsy on him, and he ended up having some issues with his lungs, just how they developed. They just didn't develop quite the right way, even at 39 weeks. So obviously I was devastated, going to the hospital, expecting to bring home a baby,
right,
and then bringing home one. And at that time, I don't know, I was grateful for the wraparound services that my hospital had, where they gave me memory boxes and hands and molds of his feet, a lock of his hair. Like, they gave me so many things that I didn't even know I needed at the time, until I was ready to really grieve what was going on with that. So obviously I ended up getting pregnant again. I ended up going through a lot of fertility testing with the second pregnancy to understand exactly what happened, to see if that same thing would happen with my second pregnancy. Obviously I knew kind of early on, probably at like 11 weeks, what I was having, because I went through fertility testing fairly early.
Right.
So probably about 12 or 13 weeks, I knew I was having a girl. And, my firstborn was a boy. And then with the baby girl, we were just going through the pregnancy. Obviously I got to 39 weeks with the first pregnancy. So I knew the second one I probably would get, closer to full term, or however it worked out. But I ended up going into preterm labor with her at 18 weeks.
Oh, my goodness.
Ended up having cervical insufficiency. That was my diagnosis. So obviously my cervix opened early.
Right.
Went back to the hospital. I think I was already 2 or 3 centimeters dilated. So obviously they couldn't do anything. You know, I was in labor and had to have her. So I always joke that I had a VBAC because I actually did.
I
I
don't
joke about it, but
know
it's kind
why.
of
The fact
true.
that
It's
you
not.
can find a joke in the midst
I
of
know.
that is woo.
I know. It, obviously, it's in hindsight looking back on it, but obviously, you know, with babies that small,
Yeah,
you know, if medically you
right.
can't deliver them through
Yeah,
C-section. So,
yeah.
I had her vaginally, and she lived probably for like a 1 or 2 minutes, not long, but we were able to see her breathe, and even at that little, she was about 1 pound and probably like 12, maybe 11 or 10 or 11 ounces. So she's
Hmm.
very, very little. And the same wraparound services happen at the hospital that happened for my son with her. The difference was obviously she was so small. It was a teaching hospital that I was at, so they gave her body. I decided to give her body back to science so that, you know, the medical students and doctors there could do more research on babies, especially who are small like that and aren't at that vitality age, to see
Right.
what other things they could do. So
That's a really interesting choice, especially, in the Black community, we're sometimes like uh, very, and rightfully so, mistrustful of science and experimenting and things like that. So I'm just curious what led you to that decision.
I think with my son, because we did a huge burial plot,
Hmm.
funeral, memorial type thing, I knew, because this was probably within 6 months of each other. So I buried my son. I got pregnant again like a couple months later, and then 3 or 4 months later, I had lost her. So I just decided not to go through that process again.
Sure.
I think they gave me the option. The same funeral home that buried my son did have an option of cremation, but I just decided not to do it, mainly because
Right.
I felt like, there are a lot of babies that are born early, earlier than
Yeah.
20 weeks. And I was just like, maybe they could find something that could keep babies
Right.
alive, I don't know.
Right.
So I
Right.
did. And then they did do the hospital at the time, which a lot of hospitals are doing. They did do like a mass memorial services for all
Hmm.
the babies who were lost in that quarter.
Hmm.
And then they did something
Hmm.
at the end of the year for like Christmas time for
Sure.
those babies who were lost at the
Right.
hospital. So I appreciated all of the services that the hospital offered me, to connect me not only to grief support groups, to make sure that I had those memories for my babies, but
Right.
also to for my OBGYN practice, because it wasn't just one doctor. Obviously, you know how this
Yes.
works. You get multiple doctors. They all knew me and they knew my story. They knew what I was
Uh-huh.
doing. So when I was ready to get pregnant pregnant again, they were like, give your body some time to heal, what have you. And they really supported me, so much so that only two doctors in the practice would see me, basically, because they felt like, oh, well, she's a little bit more high risk. Let's work with her and a maternal fetal medicine
Right.
specialist to get more details. So to make a long story short, I ended up getting pregnant again. I ended up having to get a cerclage place with my
Uh-huh.
third pregnancy with my son, who I have, who's still here today. But the biggest part with that journey, outside of going through a major surgery during pregnancy, I was 19 weeks along,
Hmm.
um, was getting up until about 31 and a half weeks, almost 32 weeks pregnant, and having discomfort. And I knew it wasn't labor. So luckily, the doctor who was on call was the same doctor who delivered my son, my stillborn.
Okay. Okay.
And she saw my face as soon as I was rolled into the triage area, and she
Right.
immediately wrote me back to do a crash emergency C-section on me, because
Seriously.
yeah, she knew, because she knew, she trusted me. She trusted me in how I felt about my body. And if she didn't
Right.
listen to me, I wouldn't be here with you. Like my body, my abdomen was full of blood. I had a full placenta abruption. My son was born not breathing. And I had to get 9 blood transfusions. I had to get airlifted from one
Mm.
hospital to the next to get more blood platelets. I almost died. Like, I literally almost died. My family was called in.
Oh
And it's the reason
my
why Black
God.
Maternal Health Week is important, because if that doctor did not know me, if it was any other doctor that was on call that day and did not listen to me, I would not be here. I wouldn't have my son. I would have died from, hemorrhaging from that placenta
Right.
rupture. So
Right.
she was very gracious in the sense that she saw me, and literally within 15 minutes, we were in the emergency room, and they did a crash C-section to get the baby out. So I did have
Oh,
my rainbow baby, which is a rainbow after my storm of losses. Obviously,
yes.
he was born with complications, and he has a disability as a result of how he was born.
Okay.
But he's almost 10, and he's
Okay.
still growing and living and thriving. So, but yes, my birth story inspired the work that I do for sure, because I knew that there were other women, not only women and birthing people who have gone through this, but I knew there were other
Mm-hmm.
Black women who've gone through the complications
Sure.
of
Yeah.
trying to get
Yeah.
pregnant, trying to stay pregnant, Lord, and then bringing a healthy baby home. I was like, I know there are other women who've gone through this, and it's
Absolutely.
not a factor of age. It's not a factor of, social economic status,
Mm-hmm.
degrees. Like
Mm-hmm.
we've all gone through something similar, and
Right.
why sharing our stories. It wasn't until I lost babies where more family members start to share that they've had miscarriages and they've experienced
Yeah.
stillbirth. And,
Absolutely.
like it's
Yeah.
just something so common that we just don't talk about. So that's kind of how the
Especially in the Black
podcast
community.
started. Yeah,
Yeah.
that's how the podcast started. I wanted to really hear from other Black women who've gone through this experience and have that common shared story that we have, but also talk about really what healing looks like. How did they
Mm-hmm.
grieve? What coping tools that they
Right.
used, and that's how Sisters in Loss was born. And we've been going at it since 2017. It's almost
Okay.
been 70 years. It's been a
All
long time.
right.
Yeah.
So do you ever feel like in the course of your losses, did you ever feel like you were mistreated or ignored or people weren't listening to you or was it that because sometimes you hear that a lot of us get into this work
I
because of those
do.
type of experience. Did you have that type of experience?
I did. With my second loss, I did, because I feel like they dismissed me in the emergency room.
Okay.
And I told them that I was having, pelvic pain.
Mm-hmm.
It felt like labor, and that, I was starting to hemorrhage. And little did I know, but now looking back on it, I probably was starting to pass my mucus plug, because especially since I went into the hospital and I was already 2 or 3 centimeters dilated, went
Right.
to the emergency room 4 or 5 days earlier. That's probably what was starting to happen to my body, but they didn't even
Gotcha.
examine me. They didn't even do an ultrasound. Like, they just dismissed me and said, hey, you just have some, you may have a form of placenta previa, which was never
Right.
the case, right?
Right.
Like, I didn't have placenta
Right.
previa. And it wasn't something that was apparent and ongoing throughout the entire pregnancy. So yes, I was dismissed, because I think if they probably would have done an examination of me, or at least an ultrasound, to see if my cervix was starting to open and I was in labor, maybe they could have done something to stop it. Maybe they
Mm.
could have given me a massage then.
Right.
So then I wouldn't have waited 4 or 5 days later, going into the hospital in full blown labor. And
Sure.
I may have had my daughter here. They could have
Right.
possibly saved and prolonged that pregnancy. So
Gotcha.
yes, I have had that experience. And over the 300-400 people I've interviewed, they
Mhm.
all have had similar experiences
Okay.
where they have not felt seen, they have not felt
Mhm.
heard, they
Mhm.
have felt valued in those spaces or respected
Right.
in those
Right.
spaces. And their dismissal has not only cost them the life of their babies, but also in some cases trauma to not only their physical bodies, but to their mental health.
Sure. Absolutely. But then it also sounds like or I should say not but and it also sounds like on the flip side, you definitely had at least one experience where someone really listened to you,
Oh, for
someone
sure.
really knew you, and you can see how much of a difference that makes.
Absolutely. Yeah. So I've had the positive experience as well. Because like I said, I wouldn't be here if my doctor did not see me and listen to me and trust me that I knew my body was not in labor, that something else
Right.
was going on with my body.
Mhm.
Yes.
Yeah.
So yes, I've
Okay.
seen both sides of it. And it's really about just that personal relationship with your provider,
Yeah.
which is very hard to do. But, I think that we all have the responsibility to really create those birth teams around us. And if our providers aren't listening to us, we need to try to switch providers.
Absolutely. And I'm curious, was the doctor who delivered your son, your stillbirth, and then the emergency C-section, was she Black? Was she
No, she
white?
was a
And I
white
think,
lady. She was a white lady. She
okay,
was. She was
okay,
a white lady,
okay.
but she listened to me, and I trusted. I think the throughout my journey to having kids, I never felt like that practice or those doctors were negligent or anything. I think it was
Mhm.
just probably obviously time, space, just what was happening. But in that other pregnancy, you know, I trusted them that they were going to make sure that I had the right team around me. It
Right,
wasn't just them. Obviously, I think I saw a perinatologist as well as
right.
another maternal fetal medicine specialist during my third pregnancy. So it was like the full team of doctors working together. I think I was in a doctor's office almost every week just because they
Right.
were monitoring, you know, the length and the of my cervix throughout that whole pregnancy. So I trusted them wholeheartedly, not
Mhm.
only with my baby, but obviously with my life, because I never knew
Yeah,
obviously what was going to happen
yeah.
with with my maternal miss that I had that happened.
Gotcha. And I think that one of the messages and things that sometimes I struggle with is that sometimes we paint broad brushes in relation to maternal health and Black maternal health specifically. And it sounds like what you're saying, and what I think you would agree with, is that it so much boils down to that individual relationship and treating each individual as a person, meeting them where they are and what their needs are, and not like generalizing and things like that. So sometimes, you know, you want to look for someone who respects you, who sees you, who's going to listen to you regardless of what they look like.
Correct, 100%. And you know, I think the added bonus for those physicians who do look like you, who do see you in that manner, is an added bonus. But don't
Yes.
discount all the other physicians that are in your area that are covered by your insurance, because ultimately, you know, your insurance plays a big role in the
Well,
physicians and the practices that you know, the OBGYN practices that you choose. So
yeah.
yes, but if they aren't, you know, aren't listening to you, or if you want to try something different, you know, there are probably other providers out there who have those specialties. And I think that we should be open to not being so loyal to certain OBGYN practices, you know, open it up a little bit. There's
Yeah.
opportunity out there.
Sure.
Let's get another opinion.
Sure. Yeah. I mean, and then part of the problem is, as Black women and birthing people, we have to fight harder to be seen and for people
Sure.
to notice us and to take our concerns seriously. What are some of the things that you, especially in the infertility, which can be taboo in Black communities? I think we're getting better about it, but infertility and pregnancy loss, there's so much wrapped up in women being fertile as part of our value and our worth. What are some things or services or points that you have to offer surrounding that, especially during Black Maternal Health Week?
Yeah, so obviously with pregnancy loss and miscarriage, it's very common. You know, obviously my story is one story. I'm sure that you have a story, or you know someone around you have a story. You know, 15 to 20% of pregnancies do end in some form of loss. So that means like 1 out of 4 people have gone through this. So it's extremely common.
Yep.
I would say even on the fertility front, that you know, there's a lot of research out there that shows that more Black women do experience fertility challenges due to either unexplained infertility or due to, you know, not being diagnosed properly with like
Mm-hmm.
endometriosis or polycystic ovarian syndrome.
Yep.
And then, you know, majority, you know, 85+% of Black women under 50 have uterine fibroids that we don't know about until we're trying to conceive and we get off of hormonal birth control. So
Right.
I always encourage people to go and know their numbers, know their stats, know what's actually happening inside of your uterus and outside of your uterus, and ask more detailed questions about your maternal health, because that's only going to prepare you for when you're ready to conceive and you're at that point where you're trying to have a child. The other part about fertility in general is just the barrier. Um, the financial barrier is always going to be a factor.
Mm-hmm.
We know how structural and institutional racism has worked in
Absolutely.
throughout all of our systems, it
Yep.
does not negate the fact that, you know, our white counterparts have more disposable income based off of how racism has played a role in the US. So it's easier for them to drop that 30K plus on
Sure.
an IVF or IUI treatment
Sure.
compared to black individuals, black birthing people, black families, where
Right.
the financial burden and barrier is more greater.
Yeah.
So I think that that is a big factor, and something that we talk a lot about on the Sisters in Laws podcast is how can we make sure we finance these treatments, because we want to grow our families, obviously, in this using this scientific way, but we're not breaking the bank and we're
Yeah.
not going into debt, and
Yeah.
we have the ability to do the same things as our counterparts, and we're not using that as a burden and a barrier for us to grow our families.
Absolutely.
But black women still have an increased number of fertility issues. Black women and black men. I'm not going to negate that fertility
Oh,
is
yeah.
a spectrum, right?
Yeah.
It's not just on women.
Uh-huh.
We have male factor infertility as
Yep.
well, but the financial burden is a huge thing. So there's a lot of options that are out there, a lot of grants, a lot of other creative methods
Sure.
people do to make sure that they can grow their families in other ways.
Absolutely. Now, one thing I want to talk about, especially in relation to infertility or pregnancy loss, is this concept of, especially for Black women, personal responsibility, and you just got to eat better, and you just got to lose weight, and how
Yeah.
that plays into the things that you provide, and information or things that you see people experiencing surround that. Because I feel like we often get blamed,
We do.
like for our own problems, so to speak.
Yes, so that is typically the messaging that's out there, that, you know, losing weight would help us to conceive properly. I think or eating more healthy, you know, exercising more regularly, you know, I think that's good for all of our health, right? Not just our maternal health, just in
Sure.
general. All of our physical health, our mental health, we need to do all those things
Right,
all the time. But I don't think
right.
that's a barrier or a factor for why Black women are not able to conceive,
Yeah.
right? We aren't hyper fertile, like you said, like, you know, like that's not a value thing for Black women like it was back in enslaved times. We truly have other issues going on, you know, whether it's stress or just the burden of what it means to be Black and woman
Yeah.
in a racist society and system that's not set up for us to succeed. So I always encourage women to make sure that they are coming to those places with their whole selves, and that they aren't holding back on how they truly feel about
Yeah.
what's happening to themselves, what's happening to their
Mm-hmm.
bodies,
Mm-hmm.
and making sure that they are receiving actionable things that make sense to what their diagnosis may be. And
Yeah.
if they aren't, they want to make sure that they go get a second or third opinion on exactly what that is. And then the power of the internet, the power of social media can work to our advantage. We can go ask people, just put it out there and see what people come back, because people know people know someone who's gone through so and so, may have had this diagnosis, that
Right.
can formalize and push them towards this fertility person or what have you. So I think that that's the beauty of community, it's the beauty of sisterhood, and it's the reason why I always say that sharing our stories not only gives us power, but it also helps us heal, because now we have another tool in our toolbox to help get us to the next side. And for many of the folks who listen to you and your podcast as well as mine, they
Uh-huh.
want to become mothers, they want to become parents, so they
Mm-hmm.
need to have those extra tools in their toolbox to do so.
Definitely, definitely. Now, I could talk to you for, I mean, you just have such a wealth of wonderful information for, for days. We could talk about this, but I do want to give you an opportunity. Did you have a Black Maternal Health Week meetup? Is that
I
right?
did.
Okay.
We had a meetup.
What were some of the takeaways from that?
Yes, what I took away from it is that we need to get offline and meet up in person and
Oh,
actually see each other,
right.
experience one another collectively. I think the pandemic has made us, you know, kind of insulary and want to
Uh-huh.
be, you know, by ourselves and isolated. But
Right.
no, I think meeting up allows us to say, hey, we see each other. Like, you have other people in that live near you, that live nearby you. Let's
Sure.
exchange information. Let's meet up again. Let's see if there's synergy there, just to have conversations. Like, we talked a lot about lactation, lactation after loss, which a lot of people don't talk about. Like,
Yeah,
after you lose a baby, especially in the
yeah.
second trimester, that you
Producing
still are
milk.
gonna get milk, and
Mhm.
how did people deal with that? We talked
Yeah.
a lot about, what birth work looks like in this stage and age, and how do people really hire doulas and hire other birth workers, and what are the problematic places that people give birth in this area, in
Mhm.
the DC, Maryland, Virginia area. So we talked a lot about it, a lot of those different things, and then what we're going to do to move things forward. A lot of those folks that were there want to meet up again, and I think that's, like I said, it's a power of sisterhood, getting together and making sure that we have that community. I think that the whole premise of Black Maternal Health Week is not only to really highlight, obviously, the disparities that are happening,
Mhm.
the maternal health crisis, but also for us to find our community, find your community in your areas, go to those events that are in your local areas, and to make sure
Right.
you find those people who are out here who are really doing the work, and some of that work may be something that you want to be a part of.
Gotcha. And then so definitely just also focusing on solutions and ways to help move us forward so that, we're not needing to, the 25 years from now, we're not still talking about the same things.
Absolutely.
Yeah, yeah. So then I guess as we finish up, definitely, do you have like a parting piece of advice or something that you would like to share both for any Black mamas who are watching and then for anyone who is wanting to support Black mamas?
I would say that we want to make sure that we continue to listen to Black mamas, that we trust Black mamas,
Yeah.
and that we respect Black
Mhm.
mamas in all of these birthing spaces on the entire continuum of perinatal care, and that you go out and vote, because ultimately,
Please
that
say
is my
that
call
again,
to
please.
action.
Yeah.
That is my call to action. This is an election year. Your vote not only matters locally in your local jurisdiction,
Yes,
your state, but also federally. We need your vote,
yes,
because
yes.
ultimately, this is the only way that a lot of these policies are going to change and move forward, and that these monetary funds are coming down through the federal government to our local states in order to continue to do this work, so that we
So
can
important.
continue to impact and make sure that we're continuing to save Black moms and babies, and they aren't dying prematurely based off of the institutional and structural racism that's in our healthcare system.
Gotcha. Thank you. Well, please tell us where everybody can find you and your resources and contribute to your work and the things that you're doing.
Absolutely. You can find me at Sisters in Loss everywhere. The Sisters in Loss podcast is also found everywhere, and we're on YouTube, so you can go actually watch some of our episodes as well. And you can find
And
me
your website, you
personally,
said?
yes, sistersinloss.com. And then
Okay.
you can find me at Erica Michelle Free on Instagram. That's my personal page. But all of our resources are on sistersinloss.com. We also host a weekly grief support group in partnership with Postpartum Support International. That's every Thursday at 8 p.m. Eastern Standard Time. So if you are interested, just go to our website, sistersinloss.com, and /PSI. It'll take you directly to the link where you can register for the next week's grief support group.
Awesome.
It's an amazing group. It's a small group, about
Right.
15 women. We get together every week and we talk about grief and loss, healing, and coping
Oh,
tools.
nice, nice. Thank you so much for all of the wonderful work that you do and just being such an amazing light in the community to help Black mamas, help people through infertility, through loss. And it's just so amazing and inspiring, really, to see how you have turned such a difficult circumstance in your life into something that's so helpful and it has impacted thousands and thousands of people.
Well, thank you so much. And thank you so much for your work and your work with Tiny Health. I appreciate you.
All right. Thank you. Thank you, everybody. Have
Bye,
a great day.
everybody.